While closing, let's talk a little about the palsies. If there is a recurrent laryngeal nerve palsy, complete palsy, the vocal cord usually get in a cadaveric position in the vocal the midline position is the median, it is paramedian position. It does not move at all. It does not adduct or abduct because the only muscle right now function is cricothyroid, that is actually the tensor of the vocal cord. So it does not move at all. So the respiratory problem are rare actually because the problem usually arises when you cannot close your glottis. When you cannot close your glottis, every time you drink something, something will go inside the trachea. But it does not usually pose a problem because the normal vocal cord has a tendency to compensate by crossing the midline and reaching the other vocal cords on its side. So this is why it acts. If there is a partial injury, the partial injury, the Semon's law says that abductor fibers are affected first. This law says that in most of the nerves, the abductor fibers are on the outside. So when there is an injury from the outside, the abductor fibers are more likely to be damaged. If there is a partial injury, abductor fibers are affected, then the vocal cord will be in more median position. It will more near to the midline. It will be more prone to close the glottis unnecessarily, but again, due to the healthy other side vocal cord, you increase and decrease the distance as you please. If there is a bilateral recurrent laryngeal nerve palsy, both of the vocal cords remain in cadaveric position. The different position are shown here: the median, paramedian, intermediate, abduction. So it remains in this intermediate cadaveric position. Both of the vocal cords remain that, and the V-shaped glottis remain open. So that's the point. You cannot produce a sound. The sound cannot be produced because to produce a sound, the vocal cords have to be brought closer. This is the sound that the person will be able to produce. The strider will be produced a little because you cannot, when actually you are taking deep breaths, the vocal cords are abducting a little. You cannot abduct either. You cannot adduct, you cannot abduct. And the worst situation, the worst effect of this injury is that the glottis is not closed. It cannot seal the airway against the food and drink. The person is hampered for life from drinking water. As soon as a person drinks water, it goes into the trach. So this is an indication for tracheostomy. This person cannot live a long life like this. So what we do is an opening is created here in the trachea, and the upper end of the larynx is closed so that the breathing continues from here, and the food intake can be continued from there. So tracheostomy it's indicated, and this is not due to the closure of the airway. This is due to the failure of intake of food. Partial recurrent nerve palsy. If the palsy is partial, abductor muscle is more likely to be damaged due to Semon's law. The abductor fibers were outside, they will be damaged. If the partial lesion is on the one side, one vocal cord will come to the median position, but the other vocal cord will compensate by getting away or closer. But if both of the vocal cords, both of the recurrent laryngeal nerves get partial palsies, partial injuries, abduction for both of the vocal cord will be lost and both the vocal cords will come to the midline. And this is an acute condition. You have to do tracheostomy immediately because the vocal cords are closed, stuck, it will close, and the airway has been blocked. So you have to act immediately to open another airway, that will be tracheostomy right here. And there is an if there is an paralysis, if we're talking about the recurrent laryngeal nerves, they are usually damaged when ligating the inferior thyroid artery. That is one of the most important cause. But other structures, other injuries along the way that will be traumatic or due to tumors, they may lead to the recurrent laryngeal nerve palsies. this brings us to the end to the external laryngeal nerve. This only affects the tensing of the vocal cord. Cricothyroid membrane does not work, and that lead to the loose vocal cord that are not under tension, that leads to the deepening of sound, hoarseness of sound. A person is unable to produce high pitch sound, and when you're looking through laryngoscope, it is not as straight the vocal cord as it should be. So these are the different injuries we discussed. So that's it. We have come to the most of it. These are the resources we have used. So thank you so much for listening to me. If you have any questions, suggestion, or feedback, please do mention in the comments. We'll get back to you with all the answers we can. Keep tuned with us for the future videos. We will be completing our head and neck session in the near future. Then we will move on to the our other aspects. And please follow our channel to look for the up-to-date and extensively discussed videos regarding anatomy and physiology. Thank you so much. See you next time, inshallah. Allah Hafiz. Good night.